This one, he's got it here. Thanks, Anna. So this is just like work. I see my clock's already ticked down to 19. I haven't started yet, so when you say, what's the budget? It's going to be lower. Thank you all for being here. It was so nice outside and beautiful outside. I actually thought about not coming and just putting it on automatic, but I appreciate you all being here. I chose the topic for this group on purpose. This is kind of one of those rare forums where we have contractors, architects, engineers, owners, suppliers, all in one forum. And if you don't leave with anything else today, leave with the message that as we deal with the challenges in healthcare, they're really up to us to deal with. Don't wait for the government. Don't look for the solutions to come from there. They got to come from us, one. And two, as facilities professionals, we have a great role we can play in dealing with those. So I'm going to talk a bit about challenges, the very short version. If I went through all of them, it would go on for days. I'm going to talk a bit about some facilities imperatives and a couple things we're doing at Banner. I know I'm preaching a little bit to the choir, and it might be a bit obvious, some of the things that I'm saying, but I wanted to set the base for the whole group. Start with the challenges. And like I said, I could go on for a long, long time. It's a challenging business to be in right now. We're being pressed from many, many directions, but I'm going to focus on a couple. I think the first thing, though, I want to do, though, is if you're not convinced that healthcare needs to change, I'm not sure anyone is not convinced. I think everyone is convinced. When you look at this slide, you ought to be. We're in dead last place on cost. Or first place if you score it that way, but I score it like golf. So we're in last place. And it's a system that we've created, but we haven't fixed. So some of you are thinking, okay, so we spend more here, but we get great care, and we do get great care. Maybe the best care. Well, guess what? We do not get the best care. We're in last place by every one of these measures. So clearly, we have some work to do. Clearly, we've got to change the healthcare system. So we have too much to offer to have those type of statistics. Everybody wants a change. A lot of talk about change in healthcare right now. The question is, who's really going to do it? I think it should be us. I think we can start the change. So I'm going to start with some of the challenges from Washington. I used to update this slide a lot because every week there was a different proposal. I gave up. I quit. I'd be changing it daily, hourly right now, so I've just left it. All of the proposals lead one place. Big cuts in Medicaid, big cuts, reduction in reimbursement in Medicare, big hits financially. And I think the message to all of us is start dealing with it. Don't wait for legislation. Start dealing with it. We are all dealing with it. I think you heard a lot of the right answers this morning. Bottom line, those of you that are in health systems, guess where all those cuts are aimed? You know where they're going. They're going towards the hospitals. At the same time, we have a lot of challenges from our consumers. We have succeeded in somewhat changing the geography or the topography of healthcare. Consumerism, high deductible plans, the baby boomers are coming versus millennials. So consumers are making choice right now. They are deciding to do or not do things based on cost. The cost of your care keeps going up because you all have those wonderful high deductible plans. Every time you turn around, you get a bill. So I didn't used to pay for this. Did I used to pay for this? I don't know. You pay the bill. Well, people are starting to make choices. They're choosing not to get care, or they're choosing where they're going to get care. And we're seeing it. We're seeing it in our volumes right now. It's showing up in our revenue at the moment. They're making a lot of interesting choices, kind of like this one. I don't think we've gotten to there yet, but the time may come. Our population is changing, so we heard a little about millennials last night, and it's kind of interesting to look at the millennials' use. They're less likely to go see a primary care physician. They're less likely to schedule a visit. They basically want the care when they want it, when they need it. Kind of makes sense. Many would avoid going to see a doctor to save money. They'll make that choice. And almost everybody, I left my phone over there, most everybody wants their care delivered right here in their hand where they are. Not unreasonable. So how many think millennials are really going to be driving where we go with healthcare over the next 10 years? Fun. No one. Well, I got one. I was going to say no one fell for that one. Well, the answer is no, they're not. People like me are, the baby boomers. We are growing in big number right now. Over the next 20 years, we're going to grow dramatically in number. And given our, I'll call it our mature state, we use a lot of healthcare, a lot more healthcare. So we're really going to be the driver, but at the same time, and we have different needs. We're going to have to develop a system that can serve the baby boomers, but also respond to the millennials in different ways. Who knows what's going to happen with Medicare? My favorite bullet on here is the fourth one, where it says, the baby boomers indulged, perhaps more than the rest of the population, so we have more problems. I won't go into what indulged means or what it includes, but it is a factor. But we're still cost conscious, so we do have that in common with the millennials. We tend to seek care more traditionally, but we still care about the cost, and quite frankly, we also like using the technology. We're not as adamant. It doesn't have to be fused into our palm and welded there, but we do use it. So we do have those needs. So we have those challenges. I like this slide. I've used it a number of times. This compares the cost of, there's kind of two messages here. First is, what does care cost in Europe as the population ages? You can see that curve. And what does it cost in the US as the population ages? Kind of scary. One, that there's a difference, that great, but two, that the cost of our care, so when you think about the number of baby boomers coming in and what the cost of care looks like, that's pretty dramatic. Now, I always get asked, well, how do you explain that difference? And actually, I have three explanations. It's diet, the food, the wine, and the walking in Europe. I really think that is a big difference. Some other challenges from our competitors. Coming in, market disruption, mergers, shrinking pool of business. And that's kind of the bottom line. As people are making those choices, our pool of business is shrinking. We're all fighting over it right now. We're all trying to find that edge, position ourselves for the best capture of the remaining market. Disruption, you name it. You know, the technology that's flowing out right now, a lot of it is handheld. How many have done a handheld doctor's visit on your phone? Several. I have. I don't know where the doctor was or really what accent I was hearing, but at 7 p.m. when I had scheduled the appointment, he popped on my phone. He said, hold it up, look at this. He said, oh my. And I said, well, that's not the problem. And he said it was something else. And he sent the prescription in, and visit was done. A lot of consolidation occurring right now, really looking for scale, looking for coverage, looking for an edge, looking for leverage, looking for ways to better serve the populations that were occurring. But those mergers, the mini mergers, those are incredibly time consuming. We've done several mergers, and it's a lot of work. It's not just the business part of it, it's the whole culture. In fact, the culture is the majority of the work when you try to merge two organizations and achieve. That's why so many of them fail. So the mergers are a lot of work and a big demand, but very essential right now. I'm not sure who's going to eat who in the end. My big question is the insurance companies versus the healthcare systems. You know, are they going to align, affiliate, or merge? And I'm not sure. So here we are at the moment. But I think the real answer is we're the ones going to pull ourselves out. We're the ones that are going to solve our problems. So I want to talk a bit about that. We actually know the answer. This is one of those tests where we know the answer to the test. We know exactly what needs to occur. It's as clear as the sign on the right. We know it's a big mountain. We know we have to prepare for population health. We know we have to pursue our consumers in a different way and provide access to our consumers in a different way. We know we have to consolidate more than we have and distribute our ambulatory care so we reach our care out into the communities and standardize on what we do and make it personal at the same time. So we're standardizing, but we're making it personal so each of you get what you need when you need it. So you know the answers. The hard part is figuring out how to get there, because we still have to perform in today's market, which is a different world. We haven't changed healthcare yet. We're still living in today's market with today's reimbursement, most of it in a fee-for-service world for some of us, others no. And we have to perform very, very well, and it's getting hard. So you have to have a full energy towards how we perform today and a full amount of energy towards how we change for the future. So that's the kind of schizophrenic world we live in at the moment. Let's take this into the facilities arena, because I think there is definitely some things we can do. I love the facilities arena. I've been in the career for 40-something years. I've done a lot of other things in healthcare, but always come back to facilities. And the nice thing about it, if it's going on in healthcare, we're involved. We're either building it or we're maintaining it, but we're there. We're touching it in some way, shape, or form. So we're in a great position to support all that's going on. But in a particularly good position to try to help the cost. It's not easy. We've been faced with cuts for some time. And a lot of what's happening in the support services for the past few years is take 10% out, you take 5% out, you take 2% out. No one got 2, everyone got at least 5 to 10. So we cut. But we can't cut ourselves to greatness. We have to change. And I think there's some things we can particularly focus on. So on the operating side, these are my top 4. Energy and how we operate our plants. We can operate our plants much more efficiently, much more effectively using technology and lower our energy costs. And our energy costs are enormous. We're bringing ours down several million a year with the work we're doing right now. Efficiency, having the resources in the right place at the right time. We don't need fewer, but we need to get more out of what we do have, and that's really going to come through technology and data, the last 2. So using the data we have and using the technology, creating a mobile workforce, we can deploy our workforce much more effectively and efficiently than we have in the past. We used to have people walk back and forth on a campus. I go to a job, I walk back to the office, input it, pick up the next service order and walk back. That could be a 10 or 15-minute walk. Add that up through the day. Obviously, they would take more out at a time. Now we've put iPads in everybody's hands. They're mobile. Not only do they have their service orders flowing and they can close them, but they have all the information they need to respond. It accesses all of the databases and information on the facility. So using technology, and then we're using that data to understand where we're overstaffed, where we're understaffed, where we can use people differently. Now, I noticed last night when I looked at these, I quoted somebody. I found this really great quote about smart things leaders do in embracing data, and I looked at who it was. Did we see him last night? I had a vague recollection. I thought so. So well stated. So that's the operating side. On the capital side, we've got to bring the capital costs down, and that may speak to a lot of people in the room that can help us do it. We can't sacrifice value. We can't just build cheap facilities. You can do it. It's easy to do. Anybody can make a facility cheap, but it's not smart because then it costs a lot to operate. But we have to figure out how to make them cost less. Part of it is we're just getting a little large in our facilities. Some of it's driven by standards, and we may have to deal with the people who develop the standards that keep adding a foot to the patient room every other year. Pretty soon it's going to, fill up the parking lot. But we have to get smarter in how we configure our facilities to bring some of the size out and add the efficiency in. One idea that keeps being thrown at me is, why don't you build a 20-year building? You keep talking about building a 40-year building and the life cycle cost, but maybe we don't need a 40-year building. We need something that's going to serve our needs for 20 years. And I'm still trying to figure out what a 20-year building looks like, but we should figure things like that out. And industry advances, and that's probably a big one in capital for me right now. I think we've come a long way in the design and the construction industry in the past few years. I think with BIM and integrated project delivery and the way we deliver a project right now, actually I don't refer to the construction phase as construction anymore. I refer to it as assembly. We've already built it. It's in the computer. We know exactly how things go together. We can do many things in parallel. Now let's take it the next step. For me, that's prefabrication. Given we're assembling, Why don't we build a lot of it in parallel offsite in a controlled environment? Better quality, better safety, and lower costs, and then bring those components on as we marry the two up. We can find ways to do that and bring our costs down. A big kicker here, look at the bottom line. For every dollar of capital we deploy, we have to earn 20 in revenue. When you reverse that equation, it multiplies fast. We also need very flexible facilities. We need facilities that are going to transform. We know what we do 10 years from now is going to be different from what we're doing today, but they've got to work today efficiently. They've got to work 10 years from now, and they've got to work 20 years from now, so we can't just think about today's needs. You know, we get pushed working with our customer base to do something very specific, and we guard against letting them channel us into something that will work today, but it won't evolve as healthcare evolves, as we deploy more care, as we push more in the community. We need to be able to build incrementally. So we really have to have a long-term view. So anytime someone talks to me about a new facility, the first thing I ask is, what do we need today? What do we need 10 years from now? And tell me what the ultimate build-out is. And everyone says, well, we need such and such, such today. I said, okay, how about 10 years? Not really sure. Well, how do we create a facility that's going to be there 20 or 40 years without knowing what it's got to be in 10 years? How big, how small, how it might reconfigure. I said, go make it up. Go think about it. We'll be better off if you just think about things that might happen and we employ that into the design than just say, I don't know. We'll make it work today and we'll figure out tomorrow. I'll be retired anyway, so someone else will figure it out. We really need to look far out. And we need something that fits in the whole picture of the system. So a lot of us have been looking at this picture. Our operations folks are a little bit funny these days. They're jumping around. I need this. I need something in retail. I need an urgent care center. I need a freestanding ED. Now I need an ASC. I need an ASC and a new surgery department. And they're jumping all over the place. They're nervous. They're trying to figure out how to work this formula. We need to help calm them and say, okay, A, how does this fit in the overall plan? And B, what are you trying to accomplish? So actually, I stole this, borrowed this. I'll give it back if I have to from my friends at Kaiser. But I think it's a great depiction of all the different types of facilities and kind of how they fit together. So anytime we talk about a type of facility, I try to look at where does it fit on here and what fits with it, kind of understand that whole continuum. Finally, Banner. Banner's a great organization. I've been with them now for almost 12 years. We're in 6 states. We have about 28 medical centers, about 200 clinic facilities, 250. We're still finding them since we've taken over the maintenance of them. And they've been progressive. But one of the things Banner did that I most admired, a few years ago when the Supreme Court was ruling on the Accountable Care Act, Banner said, we don't care what they say. We've picked a direction, we're going that direction. And we've recently chosen a new direction. We've restructured, but our direction is making health care easier. We're counting on the quality, we're counting on the care. We're going to make it easier for our consumers and easier to use. And that got kicked off by our CEO standing on a stage reading 3 letters. They were awful letters. They were, your physician's gone, now you got to pick this one. No, we've picked one for you. They were just terrible. Guess who they went to? His wife. So that was quite a wake-up call. On the facility side, we have recently, I'm talking 4 months ago, folded it all into a single organization. We've always had the development and construction side. We've now put all of the operations together across the whole organization. Reports up, they all report up to me now. And our focus is really what's in those 2 green boxes, to really leverage technology, to create a remote operations center where we can manage the facilities and to utilize data and information to support how we deliver our service. We'll manage our vendors and our shared services better. We'll focus on regulatory. So that's in process now. Our target is $16.7 million in reduction over the next 2 years. It says 3, I know, but this was year 1 and we didn't implement until May, but that's okay. We're gonna hit the next 3 years. So it's a challenge, but it's a good challenge. But it's not, to me, it's not just about the cost reduction. It's positioning ourselves to find even more and to better serve the organization as it deploys and as it evolves. Finally, on the capital side, we're very standards driven. So we have a lot of models we work from. It lets us move quickly. It lets us decide on a site. It lets us move into a project quickly. But our old models, which evolve constantly every time we use them, aren't enough. We're having to create a lot of new models. You see just a partial list here so that we can move quickly on these. Final comment and summary, as I started out, we're the ones in the position to evolve healthcare. It's not going to change by itself. We have to do it, so don't be sitting on the fence. Thank you.